Very good afternoon. It's tough to be the last speaker after 4 speakers. I'll try my best. Afternoon, everyone. Well, as an academic, politician, and community leader, I've been involved in aging issues for a long time now, in Singapore particularly. Over the last 2 decades, the government's efforts to prepare for population aging have evolved to become more comprehensive and systematic. This is critical given the very pace in which Singapore society is aging. So this afternoon it's my pleasure to share with you Singapore's vision of a city for all ages. I'd like to start by observing that a city for all ages is ultimately an inclusive city. An inclusive city enables all members in society, young and old, rich and poor, to feel a sense of belonging and be appreciated as productive and full participants of our community. An inclusive society is alert to our demographic shifts and ensures that our people's interests and future needs are taken care of. An inclusive society is not just a city. An inclusive city is not just a city with impressive physical infrastructure, but it's also an enduring home. So why has inclusiveness become such a buzzword in Singapore today? I think part of the reason is that Singapore has one of the fastest aging population in the world. We need to be inclusive to preserve our social compact, support our families, and more importantly, remain a good home for all Singaporeans. Today, the population of seniors above 65 years old is around 300,000. This figure will triple to reach nearly 1 million in 2030, just less than 20 years from now, about 1 generation later. As with any rapid change, there will be unique challenges and opportunities. I'll share 3 key challenges and opportunities. First, our demand for healthcare will grow and grow significantly over the next 2 decades. This is driven primarily by population aging and the government's efforts to provide better care, not just in our hospitals, but also in the community and at home. Our healthcare spending is estimated to double in the next 5 years. Second, we will need to do more to support family members as primary caregivers. The trend of smaller families, more globally distributed family members, and more women at work mean that there will be fewer family caregivers. There should also be good opportunities, options for single elderly to age in place. Third, we can expect more of our seniors to live longer and with vigor and strength. Our baby boomers are educated and materially better off than their pre-war generation. They should have opportunities to live meaningful and active lives. We should tap on and support this important silver resource. Our strategies for a city of all ages, or for all ages, can only be effective if it enables our seniors to live the way they want to. As with any member of society, but probably more so for the seniors, we want them to age gracefully and with dignity. For us to do so, we need to be healthy and independent. We also want to live close to our family members, engage with friends and neighbors, and be given every opportunity to lead meaningful lives. Therefore, in planning for an aging population, we have sought to be mindful of the following key points. First, supporting an aging population is a collective responsibility of society, driven by dynamic partnership between the government, the grassroots, and the community. Second, we should develop good urban solutions that integrate services and the built environment. These are the platforms to collectively support our population. We need to cater for the diverse needs of our seniors and their caregivers. Third, our aged care should be affordable, accessible, and of good quality. Quality aged care encompasses institutional care, community-based care, and home-based care. Let me elaborate each of these points in greater detail. First, on collective responsibility. To adequately and effectively support our aging population, we need to establish a strong and dynamic partnership among the government, grassroots, local community to champion and drive strategies and programs to support our seniors. At the national level, we recognize that the whole of government approach is required to respond effectively to the opportunities and challenges of aging. There is already an interagency ministerial committee to look into long-term solutions and develop suitable strategies. While public agencies tackle broader strategies at the national level, we have expanded our outreach to seniors through grassroots leaders, non-profit organizations, and community volunteers. Being closer to the ground, they are able to identify micro-level needs and introduce the required solutions. For a start, we have set up the City for All Ages Project Office to coordinate among various partners. We have identified 4 precincts in our public housing estates with higher senior population: Marine Parade, Whampoa, Taman Jurong, and Bedok. These are local names. Our first pilot project started in Marine Parade at the southeastern side of Singapore. Over the next 5 years, we will be working with our partners to implement locality-based projects. If successful, we will scale this up island-wide. But while our strategies and programs are well-intentioned, seniors are only able to live well and happily if they feel rooted within the community. And how do we promote this sense of rootedness? One way is to build and strengthen what we call micro-communities. Community development researchers have found that the success of building communities is inversely related to the size of that community. The smaller, the easier. The aggregation of strong micro-communities will result in a strong and cohesive larger community. There are 3 building blocks to make building and enriching micro-communities possible. First, we need to make effort and be genuine at getting to know one another at a deeper and personal level amongst residents in that community. Over time, we form connections with each other and build trusting relationships. And thirdly, we can share and are able to understand one another's needs and galvanize community resources to respond to these needs. The strengthening micro-communities will enhance the social capital of our seniors in that community. To better illustrate how micro-communities work, let me share with you a program called the Community Outreach Program for the Elderly, or COPE, which was implemented in the Southeast District, for which I am also the mayor. Under COPE, we brought in students together with our seniors. Students provide services such as hairdressing, home repair, manicure, pedicure, body massage to seniors from the same geographical micro-community. This collaboration has allowed students to interact with the seniors on a regular basis. To date, about 200 seniors have benefited from this initiative. I've also been fortunate enough to get to know many seniors, meet seniors who live active and keep learning and are eager to give back to society or to the community. At the Seniors Learning Camp, which we organize at the district, seniors gamely participate in a variety of activities, even bravely tackling the treetop adventure, walk, and the high net. They also exhibit a strong spirit of volunteerism, participating as senior ambassadors to reach out to the larger community. Within the social infrastructure of micro-communities, we will know that our larger community are functioning. How do we know that our larger community are functioning well? From my observations, the hallmark of a strong and effective community are when, for example, we're able to tap on one another's kindness and strengths to assist the needy. That is, the heightened sense of trust and reciprocity in the community, which are ingredients of what we call strong social capital. It is when, for example, a cab driver is prepared to help and transport a wheelchair-bound elderly or neighbor to and from hospital, or a housewife who helps an elderly neighbor with marketing chores daily, that we see elders being cared for and supported by members of their own community. When our people build strong bonds and relationships across all groups for all times and all time, for example, youth help seniors living alone clean their homes and bring them to community activities and remain active and connected. And when different partners come together to work for good and for the good of the community, providing much needed services to the elderly. This collective building of our communities to support our aging population takes time and effort. In a densely populated city like Singapore, the proximity in which our residents live can both be an opportunity or a challenge in building strong communities. Much effort must be invested in building relationships where mutual support is the desired outcome in the community, enabling our seniors to age in place with dignity. Let me talk quickly on the second key issue, which is to integrate built environment and services. What we are driven to achieve is, as a collective whole, is to create a livable environment that can help our seniors age in place. It is driven by the fundamental principle that accessibility is the key enabler to help our seniors to age in place and integrate services with the built environment. Seniors can remain independent and maintain essential links to family, friends, and larger community. We're enhancing accessibility at 3 levels. The first level is to enhance the immediate living quarters of our seniors. By making the common areas and home environments safer, seniors feel confident to move around on their own. This year, for example, we introduced a senior-friendly initiative known as EASE, or Enhancement for Active Seniors. Under this program, seniors or their caregivers may choose to install a range of home enhancements. We have piloted EASE at the Marine Parade Estate and have received very positive feedback. The second level is within the vicinity of the seniors' homes. In our public housing built before 1990, not all floors are served by lifts or elevators. As our population ages, this has posed inconveniences to residents who are physically less mobile. About 10 years ago, we introduced the lift upgrading program to ensure that lifts stop at every floor. More than 5,000 housing blocks have been identified for the LUP, or the lift upgrading program, and the program is targeted to complete by 2014. So almost all blocks of public housing are now accessible on every floor. At the broadest level, we have put in place a concerted effort to improve our housing estates and making them barrier-free. Enhancement works include barrier-free features such as ramps and leveling up steps, improving connectivity between blocks, key precinct facilities and amenities, and linking access routes to traffic crossings and transportation nodes. In 2007, our Building and Construction Authority also established the Universal Design Guide. New buildings are required to design for basic accessibility. To encourage private sector participation, a 40 million Singapore dollar accessibility fund has been set aside to upgrade buildings built before 1990 to be barrier-free. Today, slightly over 100 private-owned buildings have been retrofitted with basic accessibility, and more will be upgraded over the next few years. Enhancing the physical environment to be more accessible is only part of the solution to enable seniors to age in place. The hardware must be joined with the software. Over the years, we have built senior activity centers at the foot of our HDB or public housing buildings across the island. These centers provide social and healthcare services, as well as organized activities and programs to help to promote social interaction amongst our seniors and to prevent social isolation. Beyond such centers, there are many other projects being introduced to encourage seniors to live actively and healthily, such as People's Association's wellness program, which empowers seniors to take charge of their own health by going for regular health screening, engaging in activities and staying socially connected through their interest groups. Moving forward, more community-based programs and services will have to be made available with the competition for limited space and changing aspirations of diverse populations. The strong and trusting relationship among residents in the community is critical to buffer any difficulties in the provision of such community-based facilities. The third issue I'd like to address is affordability and accessible aged care. Beyond improvements in the built environment, we need to ensure that the aged care are accessible, affordable, and of good quality. Like many countries in the world, our healthcare has traditionally been focused on institutions such as hospital and nursing home. While we will build to meet demand, the government has given emphasis to aging in place and care in the community. This is, I feel, the right direction in aged care. Aged care should be accessible and serve both seniors and the caregivers. To better support home and community-based aged care services, we will be increasing the capacity of day and social rehabilitative care places. Aged care should also be of good quality. We have been expanding one-stop integrated daycare facilities to provide social care and rehabilitative services. Relevant agencies are reviewing the standards and guidelines and building our pool of manpower to ensure good quality service. Aged care also needs to be affordable. More subsidies have been introduced by the government to help support not just the poor, but those who are in the middle income. For example, to help Singaporeans who may need more assistance, the quantum of Medifund grants available annually has been increased from 80 million to 100 million Singapore dollars. In addition, MediSave accounts will provide a one-off top-up this year to offset the increase in MediShield premiums. This is estimated to be at 380 million Singapore dollars and will benefit Singaporeans insured under the National MediShield Insurance Scheme. Further, as part of the introduction of the annual GST voucher scheme, the elderly Singaporeans aged 65 and above will receive an annual MediSave top-up of up to $450 each. The government will expand subsidies in the intermediate and long-term care sector, which is expected to be more than double by 2016. We must also continue to be innovative to meet the needs of our seniors. One of the projects we are working on is to establish seniors group homes. These are retrofitted HDB apartments which allow seniors to live in groups of 2 or 2 to 3 for mutual support and have sufficient privacy to live independently. Services can also be more efficiently delivered. I would like to just conclude very quickly by sharing about the Marine Parade Pilot Project, which features elements of our vision of a city for all ages. I've earlier shared the EASE program, where we upgraded the apartments of our seniors, which was pre-piloted at Marine Parade and has received good responses from our seniors. To identify and tailor what was required, we consulted our seniors to receive feedback. Our programs must be grounded with the felt need of the people. For example, we assume that ramps across steps would help reduce falls and allow wheelchair users to move around their homes. However, adjustments were needed because some seniors were not used to it and would trip over them. So before we enhance the physical environment, the feedback is sought from every senior. We have also worked with seniors to improve infrastructure at the precinct and town level. A group of seniors volunteered to walk around the town at different times of the day and night, identifying gaps for improvements. They came up with around 300 suggestions. Some improvements include additional handrails at main footpaths and ramps, additional senior-friendly fitness corners, and larger block numbers to ease reading. The point is that when we want to make it a city for all ages, a precinct for all ages, you need to engage the very people who is going to live in that particular community. At the town level, improvements include larger signboards, should be more rest stops, strategic locations for the elderly, and longer times for road crossings. This is to be sensitive to the elderly's needs. From this experience, we learned that we can only provide our seniors effectively if we communicated openly and work with them. Beyond improvement to infrastructure, community programs supplement our effort to meet the needs of the seniors. We organize fall screening sessions and educational talks to share how they can take a more proactive approach to live healthily through exercise. Seniors were also asked to keep fall and exercise diaries to track physical activities and record falls. Volunteers from the grassroots organizations and other seniors group were also roped in to help visit their frail seniors to follow up. So the Marine Parade project is a good illustration of how a dynamic partnership between the government and the grassroots volunteers and local community can work together effectively. More importantly, seniors can and want to be involved in improving their homes and immediate surroundings. When we build an inclusive city, a city for all ages, we are building a home that our seniors and people can adhere to, feel belonged and connected with. We are also building a community that is mutually respectful and supportive. To support our aging population, it is a collective responsibility among the government, grassroots, and the community. Seniors themselves are not just recipients of care, but also contributors and shapers of our city. To support this aspiration, our urban solutions are geared towards providing a safe, accessible, and supportive environment for seniors to age gracefully. Many of these urban solutions also support the very young and the middle-aged, especially those with caregivers. Who are caregivers? Likewise, aged care is not just for the seniors, but also for the caregivers. This way, our vision for a city for all ages is truly one which is for every resident in Singapore. There is a common saying that Rome is not built in a day. Similarly, Singapore's city for all ages will take time to develop, and we are committed to make this vision a reality. But we can do so only with the collaborative effort of the government, the people sector, and the community. Thank you for your attention.